Hello, and welcome to another episode of the CIRS Group podcast. I am Barbara,
And I'm Jacie.
and today we are doing an episode that is a very, very common question we get, is all about the symptom clusters. What does that mean? What is this fun looking, it's fun looking because Jacie created the infographic, by the way, guys. This fun looking yellow square with these white boxes. Why are symptoms in certain boxes with other symptoms, but some are by themselves, like all the things, right? But we're going to get into the symptom clusters and how it can help you identify whether or not you have CIRS, whether your loved one has CIRS. Everybody has CIRS. We all have CIRS. No, we're going to get more into it today. But of course, before we continue, none of this should be considered medical advice. Always consult your practitioner about your situation, that's unique to you, and let them guide you on whether or not they think you have CIRS. Get second opinions if you want. Anyway, hope this information is helpful for you to take to your doctor.
So when we're talking about the symptom clusters, I think it's important to preface this with why doesn't everyone who has CIRS have the same symptoms? And it's because CIRS or chronic inflammatory response syndrome is a chronic inflammatory response. And so to a certain extent, it is multi-system, multi-symptom. But for a lot of us, it attacks our weakest links. And so we might have genetically or just environmentally different weak links. So not everyone is going to have the same exact symptoms. So what Shoemaker did was when he was doing the research for CIRS, he found the statistically significant symptoms to CIRS. They're arranged in 13 different clusters. There's 37 symptoms in total. But how you look at the symptom clusters, and if you're watching this versus listening to this, there's a graphic on the screen right now. And what you do is you identify all of the symptoms that you have. And each time you have a symptom in a cluster, it counts as one of the clusters. If you have 8 of the 13 clusters, you have a high likelihood of CIRS. It's like 98.5% chance.
Yeah, you basically have CIRS at that point. And the reason for that is it's very possible to have three. In fact, a healthy person might have three of these symptom clusters. That's on the high end, but they might, maybe they've had some injuries and blah blah blah, and multiple parts of their body are affected. But generally speaking, your average person who doesn't have CIRS is not going to have eight out of these 13. That's a lot of different systems and parts of the body that are being affected by something. And contextually, if you think about that, the likelihood of you having so many different root causes that cause all this collection of symptoms is very, very low compared to the very real possibility that you just have CIRS. And that is what's causing all of these downstream effects in multiple ways for you. So,
And fun story, McMahon last year at CIRS said that there used to be this software where you could put in different diagnoses that a patient had, and it would show you the overlap of symptoms. And he tried like all of the big, like autoimmune, cancer, all of the big diagnoses that people could have, and none of them have an overlap of more than 3. So even if you are that person that Barbara's talking about and you have had a lot of damage and diagnoses and you're just genetically screwed, you get better parents, it's unlikely, it's still very unlikely that you would have more than 3 of the symptom clusters.
right. And we should also point out that there are some CIRS practitioners that really prefer to go through these symptom clusters with their patient, like verbally, and go through them. Um, and they're actually, some of them will go so far as to ask the question in different ways with different words that still match the symptom clusters. But the reason for that is some of these symptoms can be interpreted differently. It kind of depends on what you think a particular symptom means versus what you're actually experiencing. For example, vertigo is kind of a weird, that's a movie, right? No, but it's like I don't experience vertigo. That sounds dramatic. But in fact, I was one of those people who thought that. But there was a time I was staying in a hotel in Florida, and I remember getting off the elevator. And that act of getting off the elevator and kind of moving into the lobby, suddenly the whole room spun just a little bit. And my memories of that is like drinking too much back, well over like 10, 15 years ago. But that was weird, but I didn't notice that until I realized like more about CIRS and I could kind of put two and two together and realize, no, that was a moment of vertigo. No, it's not happening to me for an extended period of time, but that's a little bit weird to be happening at all, considering all the other symptoms that I have. Again, contextually, it makes more sense.
Another one that could be harder to identify because it's kind of vague. Skin sensitivity. What does that mean? That could be like erythromelalgia, which Dr. Lauren Sparks talks about a lot. That could be dermatographia, where, sorry, I should define erythromelalgia. That's a big word. So that's when you have heat sensitivity in your fingertips or toes, and it's like it can get so bad that people start icing it, which makes it chronically worse because your tolerance reduces. And so part of the treatment for that is like weaning yourself off of ice packs. But if you've ever taken a shower and you get out, like after heat exposure from the shower, you get out and you notice your toes are super red, but the rest of your foot is still skin color, that's a good sign you might have erythromelalgia.
And we'll have a link to Dr. Sparks has a YouTube channel, so we'll have a link to her video on erythromelalgia. Wow, I don't think I've ever said that out loud. In the description, if you guys would like to learn more about that, because she's certainly the expert. She's lived it, and yeah, she knows all about it.
Another thing that could be like identified as skin sensitivity is dermatographia, which is where your skin is super sensitive to any sort of external stimuli. So it could be like you scratch yourself and you could see the lines of the scratches on your skin, even though the scratch wasn't like hard enough that it should have done that. Some people can actually write on their skin. That's why it's called dermatographia, writing on your skin, which I think is cool, but could be a symptom of CIRS.
Right.
Point being, it's good to talk to a provider if you're uncertain about any of the symptoms in the symptom clusters because you might be encapsulated in that symptom and not really realize it. Then beyond that, there's a bunch of symptoms that CIRS patients often experience that aren't in the symptom clusters. And it doesn't mean that it's not a common CIRS symptom. It just means it wasn't part of the statistically significant symptom data set that they use for diagnosis.
Yeah, some of those are tinnitus or tinnitus. We've done an episode on that one. Eye floaters, which could actually be related to tick-borne illness specifically. Internal vibration. I don't think I've heard what can do I have this? What is
Okay, so
internal? I'm looking at the notes for our podcast. I'm like, wait, internal. I swear I reviewed this before, but
sounds like a good time. No,
yeah,
it's so some people who have tick-borne, which, Babesia, Lyme, whatever, they'll feel like this internal vibration sensation, almost like you're sitting through an earthquake. Like you just feel your body vibrating, but nothing is
weird.
actually externally causing that vibration. And from my understanding, typically it's most common at night when you're laying down.
Wild. Does it affect like the, oh, now I'm asking you about it. Guys, I'm learning too. Does it affect like your whole body or is it could be just a part of your body?
A lot of people experience it in their core, so like in their chest or GI.
Interesting. I think what I'm thinking of is almost like a little, like a muscle twitch or a spasm, but that might be more like on my calf or in my back or like not like inside me. So I think that's probably a different thing.
Yeah, and muscle spasms are part of the symptom clusters
Right.
because of the electrolyte imbalance. This, like the best way that I can describe it is my apartment sits over a garage. Like our apartment sits over garages. And so when the garage door lifts, I just feel like a little bit of shake and
Right.
it feels like that internally. So it's not localized to like a singular muscle. It might originate in the core, but you feel it like kind
Got
of
it.
systemically.
Fascinating. Well, there you go, guys. If you experience that, that's relatively common with CIRS. Apparently not common for me, but it's common for CIRS patients, especially if it's a tick-borne issue as the exposure. Also, mood dysregulation, that can be anything, depression, anxiety, any. I mean, I've seen some sad stories where there's certain other things that piece together where I realized, oh, that's probably a really bad building, and no wonder he became a serial killer. I'm not saying you're going to become a serial killer, guys, but
This is not an excuse to become a
this is
serial killer.
not an excuse.
If you were waiting for the, you were like, just give me a sign that I should do this. This isn't the sign.
No. The sign is to move out of that house. That's what the sign is. Don't become another Netflix documentary, please. So, but mood disrupt. I mean, I remember being in a moldy house and I just felt out of nowhere a sense of absolute hopelessness. And that was new. I have had depression in my past. I do not have it now. That came out of nowhere. And I knew, thankfully, logically, my brain was still able to say, Barbara, you're in mold. That's where this thought is coming from. Things aren't actually hopeless. It feels hopeless. You can feel this way. That's fine, but this is not real. This is mold. And it was true. I got out of that situation and that feeling went away. Thank God. So anyway, weight management issues is also another thing that people tend to struggle with. And of course, also insomnia. I know sleep disturbance is on the cluster list, but specifically insomnia, the inability to fall asleep, stay asleep, and not just because you have to get up to pee, and also maybe not just because you're in pain, you just can't sleep. It just isn't happening for you. It almost doesn't seem like there's a reason for it. That's another thing that's very common, unfortunately, with people with CIRS, but is not necessarily on the symptom cluster list.
And the next thing we should talk about is like the archetypal symptom that most CIRS patients have. Most CIRS patients have one big thing. We all have 8 out of the 13 or more of the symptom clusters, but we typically have one big thing that we got into investigating what might be wrong because of. That was a weird sentence. For me, it was arthritis. So I was actually diagnosed with ankylosing spondylitis, and then eventually I found out about CIRS. For some people, it's fatigue, and that could be anything from like just general lethargy to chronic fatigue syndrome, which we're going to talk about in a little bit again. GI issues, and it's so funny. I sometimes I talk to my boss about, and I say just like kind of casually like GI issues, and he's always like, "What does GI mean?" And I've had this conversation with him like 5 times. I'm like, gastrointestinal. I'm trying to not tell you about my poops, but you've opened the store, so let's talk about it.
This is the guy, this is the type of person that just needs you to say, I have bowel issues, or I'm in the toilet. In it? On it?
In it, I am within the toilet today.
Yeah.
Sorry, I will not be at work. I am inside of the toilet. Another one is migraines. A lot of people who suffer from migraines, that would be like their big symptom they're trying to fix. And then I kind of bucketed all of these together, which is just like not correct. But people who are really sensitive. So whether that's histamine issues, mast cell activation syndrome, multi-chemical sensitivity, or food sensitivities, just these sensitivities in general, that would be like another big thing people would typically want to fix. And so this was one of my favorite parts of my entire CIRS healing journeys. Multiple. Just the one healing journey for me. Thanks. The first provider I was working with would track my symptoms during every appointment. And so even though we weren't moving the lever a lot on my arthritic pain, it was really cool and really motivating to see all of those other symptoms kind of fall down as I went along the protocol. And that seems to be most people's experiences with fixing that archetypal symptom that they got into CIRS to fix in the first place, is that typically seems like it's the last one to resolve, which sucks. And I cannot recommend tracking the rest of your symptoms enough, just so you keep seeing that progress, even if that one big thing, the needle hasn't moved for that yet.
Right. And I want to stress the importance of focusing on the symptoms that you are either no longer experiencing or have lessened. It can be a really easy trap to fall into if you're constantly like tracking your pain or tracking the negative thing, because obviously that's going to make you focus on that negative stuff. So if you can focus on the positive side of that, like Jacie just described, yes, your main symptoms are still there, or yes, you're still in you feel stuck on some of them. If you can shift, it doesn't mean don't pay attention to those, but just make sure to, in that same moment, shift to reflecting on the ones that you are no longer feeling that are now zero or at least much less or they're much improved since you started to do treatment. That's helpful from a mental support angle as just as much as physical.
So I think we want to conclude this with the thing that we see very often when we're out in the wild is someone will tell us they have a diagnosis and we'll be like, oh, you have CIRS. So this is a not comprehensive list of some of the things that people will tell us they have a diagnosis of, and it might be helpful for them to look into CIRS.
Yeah. Autoimmune illnesses are huge. I know it's a big blanket term because it's going to cover everything from lupus to MS to alopecia to,
Ankylosing spondylitis,
and thank you.
HLA
Perfect.
B27, anything.
Yep. All of those things. There's so many. I mean, there's so many. I don't even know why I blanked out because there's a million. I'm just not thinking of them. But there's a million ways your body can decide to attack itself. And this, of course, has to do with immune issues. Obviously, that's a problem with the immune system. And considering that CIRS is going to be very taxing on the innate immune system, the two tend to go hand in hand. There's like dysfunction in one, there's likely dysfunction in the other. So that's something to certainly consider. And if you want more information on that, a wonderful talk by Dr. Nichols happened with the CIRS Summit. That was the big event that we were part of organizing late last year. So go to the CIRSsummit.com if you want to check that out. He had a great talk explaining how autoimmune illnesses and CIRS kind of play off each other, how they manifest together, and some of the things and the ways you can go about dealing with that, because it is a difficult thing to deal with both at the same time.
Just fibromyalgia as like a example of anything that is your symptoms but renamed in Latin.
Yeah.
So, for example, when I went to my provider and I was like, hey, I have inflammation of my inner eye. And he was like, oh, you have uveitis. And I was like, oh, cool. What does that mean? He's like, inflammation of the inner eye. Thanks. Glad we traded those words. And then I paid him $400. It was a great time. So anything that, is your symptoms but renamed in Latin is going to fall in this bucket.
Yeah, and it sucks and it's stupid. I mean, not Latin, but chronic fatigue syndrome. Oh, cool. I'm tired all the time. Like, this is great. Thank you for giving me a name to my issue. Doesn't tell me why I have it though. But of course, fatigue is one of the archetypal symptoms of CIRS. If you have chronic fatigue syndrome, I mean, I can't imagine there's a chronic fatigue syndrome sufferer out there who does not also have CIRS.
Mhm.
I can't see that. I don't if you're that person, how do you
Why are you
exist?
here?
Yeah, why are you here? And also leave a comment because I just don't think those things happen separately. That is the renaming of that's just telling you of a symptom that you have and not, I mean, there's no good treatment for chronic fatigue versus CIRS. There is. I would rather have CIRS. That's the moral of this story. I mean, it's the same thing, guys. Anyway.
Next up is postural orthostatic tachycardia syndrome. And that would be if you get really lightheaded when you stand up, or if all of a sudden you feel like you might pass out. That is a good indicator you might want to look into CIRS.
Yep. All that stuff gets messed up with sursiness. And of course, if you have any joint pain, spinal misalignment, lots of things can happen. And that may mean that you have Ehlers-Danlos syndrome or EDS. The S is important there. But if you there's certain things like if your thumb can touch your arm, or I don't know, there's certain tests that you could do yourself, but obviously go to a professional and see if that's an issue for you. There may be some different things that you will want to do to support your bone health and your joint and ligament and all the other things health to make sure that you're not getting into pain in that arena. But generally speaking, anyone who has EDS also, again, has CIRS.
And while we're here, I'll just mention if you are someone who needs frequent upper spine adjustments from a chiropractor, there's another CIRS Summit talk you should look at. Andrea Yordheim shared so much great information about this, but basically the adjustments don't stick because of CIRS. And so she was using that as a way to identify potential CIRS patients.
No shade on chiropractors, but I thought adjustments they made never stick. Like that's kind of the thing. You got to keep going back. But but specifically this happens more so or to a greater degree or a more ridiculous degree with CIRS patients.
Yeah, and upper spinal adjustments should only be done, I think, if I remember her talk correctly, like at max every 6 months, because it is your like cervical spine. So
Yeah,
you don't want to be cracking that a whole ton. And so if you're needing it to be adjusted too frequently, one, you're putting your those very small vertebrae at risk. And so her point was it should be sticking. If it's not sticking, it's very likely that it's related to SIRS.
interesting. Another plug for the CIRS Summit. Again, we'll have that link in the description for you. Another thing which I experienced was difficulty tolerating detox protocols. I did several attempts at fixing my gut before I found out about CIRS. It involved charcoal binders at one point, it involved antibiotics, it involved lots of things. And none of them worked. If you are one of those people who have followed too many health gurus online and or followed too many different holistic practitioners who didn't quite get the holistic picture, apparently, when they were dealing with you, like me, and you also tolerate them poorly. Maybe they're really awful, they're hard for you to deal with. I know even the Shoemaker protocol can be difficult to deal with, usually because the person's still in exposure or just is a very hypersensitive person and has to go about it in a much more careful way. But that is a very, unfortunately, very common problem for CIRS patients that they just need to take extra care when it comes to approaching detox protocols. And it may be a question of timing. You may need to be further along on Shoemaker, out of exposure, XYZ, before you actually go into some of these other detox protocols.
Then we move into like psychiatric problems like depression, anxiety, ADHD, and PTSD. And it's not that SIRS caused these things necessarily. It just makes you more susceptible to them. And it's kind of a feedback loop where also having trauma can make you more susceptible to SIRS. So unfortunately, for a lot of SIRS patients, even though it isn't part of the Shoemaker protocol, addressing trauma is a huge piece of the healing puzzle.
Yeah, absolutely. That was certainly a big thing for me. I did a lot of work on therapy in addition to and in conjunction with CIRS treatment. And I think I personally needed both of those to move further along in my own healing.
Endocrine problems like thyroid, adrenal, and hormone imbalances. One of the hallmark symptoms of SIRS is that your MSH is low, melanocyte stimulating hormone, which sounds like melanin and it should only have to do with your skin, but it's the precursor to everything in your body. It can cause melatonin disruption, it can cause dopamine dysregulation, and what we're talking about right now is these hormone imbalances. So if you are someone who has a thyroid disease, so whether it's that hyper or hypo, potentially SIRS. If you have issues with your sex hormones, potentially SIRS. Leptin resistant, potentially SIRS,
Potentially CIRS.
potentially SIRS.
Yep. And finally, a new kid on the block, only because it's been, oh gosh, 5 years now. COVID. Any kind of COVID long hauler, post-COVID syndrome. I had COVID and I've never been the same since. I lost my sense of smell or taste, or I am super tired all the time. Insert symptom here. Chances are CIRS is the main culprit. You'll notice that COVID is another thing where, it affects everyone differently. Some people were just fine. Some people didn't have any kind of symptom at all. Some people died. Like there's a whole host of things that happen with COVID. I wonder if genetics has a part to play in that. Obviously, also comorbidities, co-infections, all the other issues that came up with COVID. We don't need to dig into all that. But point being, if you are somebody that never really fully recovered after they got COVID, it's a really good indicator that your genetics may match up with someone who is predisposed to being bad at eliminating biotoxins, and that biotoxin is COVID, and you have CIRS.
Could be,
Could be.
could be,
It's possible.
possibly.
Potential.
Mm-hmm. Probable, even
Likely.
assured.
Yeah, you have CIRS. But this isn't funny, guys. I think we're laughing. We have to make light of this because we're having a good time, and we've been living in CIRS land for now, what, 3 years? But yes, I think the reason that we can have a good time about this is that at least it's an answer. It has a treatment protocol attached to it. There is hope. Is it difficult to treat these things? Yes, but I'll take that over someone saying, oh, you have RA and your joints are going to continue to degenerate and you're going to be in pain for the rest of your life. Have a good day. Take some really awful medications that have terrible side effects. That's all we can do for you. I will take the Shoemaker protocol in whatever improvement it can make in my life over a lot of this other junk that people are just going to hand you a pill to handle, to deal with it, and you'll be on that pill now for the rest of your life. I would prefer an actual treatment with an end date potentially and resiliency built up as a result of that, being better than before. So I think we do, Joe. I'm happy that we can be fun and silly on this podcast, but I do want to. I think the reason we can is because there is hope in the Shoemaker Protocol and there is hope in healing that is so much better than all this Latin name your symptoms BS, hand you a pill and a giant bill for, $10,000 like most doctors do.
Yeah. Well, if you are looking for more resources and support, if you want to hear other people's stories about internal vibrations, you can join us over at the CIRSgroup.com.
We'll see you there.